The age distribution of COVID cases in India seems to have emerged as a fresh cause of concern. ICMR data reveals that it's people in their 20s, people in their 30s, people in their 40s, which essentially millennials, the Gen X, the Gen Z, who are driving the pandemic. Why does it become a cause of concern? Because it is this section of people that will move out the most as we unlock further and further, people who will go to colleges, people who will go to work. And the government will have a serious challenge in terms of containing the pandemic with this age demographic. So Abantika Gosh, who tracks Health for ThePrint, who's been tracking COVID very closely, will help us sort of, understand the situation and the challenges that lie ahead and what is the possible solution. So please start sending in your questions. So Abantika, let's quickly first talk about the findings and the age distribution of what is driving the COVID surge.
Right. So we looked at data, we asked states for the data, and what we found essentially is that, the number of people in their 20s, 30s and 40s, the number of cases, that's really high. For example, in Maharashtra, of all cases, 56.34% are these people. In UP, that's 49.84%. That's in the 20 to 40 years. In Tamil Nadu, so because it's data from different states, right, the age breakup is different. So in Tamil Nadu, the breakup we got is for the age category of 13 to 60, which is 82%. So this is basically entire predetermined age. So all of these people,
essentially the youth and the working population,
college, only the school. In this category, there's a little bit of school population also. And also, if you remember last week, the World Health Organization had also said that people in their 20s, 30s and 40s are driving the pandemic because they're often not aware. They're asymptomatic people. They're going about their jobs. They don't know they have the disease. So in fact, when we were doing the story last week and we were talking to some experts, so Dr. Anurag Agarwal, who's with the ICMR Institute of Genomics and Integrative Biology, he told us that you have told people that you stay in if you're unwell, but these people are not feeling unwell.
Right, there are no symptoms.
They have no reason to stay in because they feel perfectly fine, but they are spreading. Because I may not have symptoms, the person I pass it on to may actually go on to develop a more severe disease.
Could be a vulnerable person.
Never know. Yeah, you never know. So that is actually a problem, not just India. The world pattern is that this particular age group is spreading the disease, even though fatalities are far less. For example, in India, the Ministry of Health data shows that 11% deaths are in the 26 to 44 years age group. So that's a very small fraction.
Right.
However, the cases in this age group are much more.
So fatalities are probably low because people in this age group don't have as many complications and comorbidities.
Right. They don't have comorbidities. Half the time they don't even know, no symptoms, nothing. So it just comes and goes.
Right. So Abantika, now given that we have this finding in front of us, which in itself is an important finding, we know which age category to focus on. But how does it work when it comes to unlock? Because people will have to go out to work, and as you mentioned, this is the working population.
Yeah. So one of the things that Dr. S.K. Sareen told me was that this is an age group which tends to defy norms. They will remove their mask, they will socialize, they will probably eat out more and all that. So one thing that the Delhi government is trying to do is use them as ambassadors. So if you use them as ambassadors, the sort of thing that happened with crackers. So that's one of the things. But I think in the long run, what we will need to do, and that is something that in the last week's COVID briefing, Dr. Vinod Paul, Niti Aayog member, he actually said that that's something that they're considering, is that we'll have to open up testing. Right now there are all these regulations, and a lot of it is still based on whether you have symptoms or not. I think as and when our resources allow, there has to be on-demand testing.
You're a busy person, Abantika.
Sorry.
No, that's okay.
There has to be on-demand testing. There has to be more, maybe at some level, maybe when schools, colleges open, maybe you can have camps in schools, colleges, that sort of, completely randomized testing, because also because there's an analysis which the IDSP has done, the Integrated Disease Surveillance Program. They had extensive talks with states, and they found that in India 80% of patients are asymptomatic. Now initially, in the initial days, they thought that these are people who had just been caught early on, so they were what we call pre-symptomatic. So they don't have symptoms at the time when they are being tested, but they will eventually go on. But now they are saying that's not the case. These are people who are asymptomatic throughout the period of infection. So doctors are saying that they've seen cases when there are 4, 5, 6 people in a family. One person is symptomatic. All the others have tested positive, but nobody has symptoms. So that's the kind of pattern that India is seeing on COVID. So I think we'll have to do something with our testing strategy to make it move away from this overwhelming dependence on whether one has symptoms or not.
Make it more randomized?
More randomized,
and focused
more
on these
open,
age
and
groups.
if I want to get a test done, I should be able to without the need for a doctor. Especially if I'm willing to pay for it, then it should be done.
Absolutely.
For last week, a colleague had, his daughter was unwell, and the doctor absolutely refused to test. So it's, medicine also has to take into account some of the concerns that people have. This person is worried, he's willing to pay for it, he's got a 5-year-old kid. Why can't the girl be tested? I think there are issues there beyond medicine.
Right.
But essentially, even for control with this kind of pattern, we'll have to open up testing. There's no other alternative.
Right. So Sanya Rao has a related question. What do these findings mean for reopening of schools? So does that also, red flag, raise a red flag about how schools can reopen, particularly for senior classes?
Absolutely, it does. Also because last week, the results of the Delhi Sero survey that were released, they found that people who were aged less than 18 years, they had the most antibodies. I think 33% kids had antibodies. That's the biggest group. Whereas these people are the ones who are not going out at all. Kids are hardly even playing these days. Schools, colleges are closed. They're not even going out to play.
Right.
Yet they have this kind of antibodies. And I mean, it's possible family members infected them or what, but obviously this has huge implications for opening up, because then again in a school setup, it's social distancing and all of that.
Very difficult.
Very difficult, yeah. In college maybe still, but in schools, how do you train like a kid who's 10 years, 12 years old to maintain social distance at all times and constantly, not wipe your face, not rub your eyes. Those things are very difficult. So I think this would have and that is partly why I think even though there are now talks and the health ministry actually has SOPs ready for schools opening up, but states and parents in multiple interactions, they have not felt comfortable opening up because of this.
Right, it's a risk, it's a big risk. Prerna Krishnamurthy, please explain the immunology behind why fatalities are less amid children. Is it because the immune responses are quicker?
See, there is no clarity on this, why fatalities are less. It has been seen that the disease severity is usually less. It is possible that because they are fitter and their organs have undergone less damage maybe than older people.
No comorbidities as such.
No comorbidities as such. But this is a very sort of superficial explanation. If there are other reasons, we don't really know what those reasons are. But that is one of the things that have been very interesting and intriguing about COVID from the very long time. But I also I feel that the real impact on children can only be assessed when the actual opening up happens, when schools happen, then you will get right now their exposure is limited to family. So it's very difficult to make an assessment without opening up and then once it opens up and then you see that yes, cases are less, fatalities are less, that would be the right time to make this assessment, maybe not right now.
Right, but as we say in the news business, this is still a developing story and there's a lot that we have to know, so we don't know it yet. Abhishek, I'm in this age group, should I stop visiting my family? So I think, with these findings, there is a concern among the younger generation as well about how much they can expose their parents or their older relatives.
Right. So I think there has to be a very calibrated approach to this. If all kids were to stop visiting their parents, that is not good for the parents' mental health either.
Right, and we don't know how long this will last.
We don't know how long this will last. So I think the best option is to maintain distance, talk to them, also make it very clear to them that this is how the disease spreads. For all the talk about airborne infection and all that, we don't yet know if it's airborne, but what we certainly know is if I touch this surface and I touch my eye, I touch my face.
And if someone with COVID had touched that,
right? I have so your defense then is your parents, everybody's defense then is to keep washing hands, keep sanitizing hands, and just stop touching your face
and maintain distance when talking.
Maintain distance. Maybe not hug family members right now, but why not visit them? Because I can see, I can see in my own circle, it has very serious mental health consequences for old people. This complete social isolation that has happened, their own social circles have collapsed. If families also stop visiting them, that cannot be a good thing.
Right. So, this is something we often forget, that COVID, besides the virus, there is another aspect to it, which is what it does to your mind.
Absolutely.
And the mental, the psychological aspect of it.
Months and months of social isolation, I think it's causing havoc. We'll probably not even know the full impact till
a long time
opening
later.
up happens and people actually start visiting doctors and all that. But it has very serious mental health consequences.
Right. Rohan Prakash, given India's large youth population, is the youth a super spreader? So, how much is of the population is in the category of say 18 to 50 otherwise, and how many cases have we seen? Does that make the youth
so
according
to the census 2011 data, 36.3% Indians are aged between 20 to 44 years, and anywhere between 50 to 80% cases are in that age group. States. So nationally, actually, 61% people in that age group are, they have tested positive. So that's almost double, a little less than double. So yeah, I mean, it's kind of difficult to say that youth are super spreaders, but it's also kind of difficult to say no, they are not.
Right.
Because the data shows that they are, let's just put it this way, that they are unwitting super spreaders.
They do not potential to be super spreaders.
They do not know, they have the potential to be super spreaders. So, and I think one thing that Dr. Sareen pointed out may also be true, that there is a tendency to defy more in these age groups, and so that kind of social consciousness is also required, that when I remove my mask or when I am careless, nothing may happen to me, but I may spread it to somebody who is not as well equipped as I am to handle the disease.
Right.
So that sort of consciousness also has to be built.
Right. There's a question from Arun Kumar. Do we really trust private hospitals for COVID testing? What prohibits them to give wrong results and earn more money? I think this comes from when you were talking about making testing easier.
Yeah. So, the counter to that is, what choice do you have? While it's a legitimate concern, it shows the complete breakdown of doctor-patient trust and all of that. But what choice do you have? In the government sector, still it's very restricted. The only place where it can possibly open up is the private sector.
Right.
If you want to get tested, that's your best bet. There's no other option.
Right. Rohit Subramaniam, in most reports it shows that women are less prone to infections. Can you please comment on this?
Actually, in the Delhi survey, women had more antibodies than the men. Women.
So which means they were infected more than
men. They were infected more than men. So the hierarchy is like this. Less than 18-year-olds, that's the highest. Then women, then men. So we can't say women are infected less. What we can say is probably fatalities are less in women. That's the global data. That's
but are women more asymptomatic? No,
There's no
way to.
no. So all we know is fatalities are less, but that's all. We cannot even say that women are
Right.
more asymptomatic.
So Aniket wants to know whether this trend about youth is and millennials is in India or certain select states, but that I think you've already talked about earlier on in the conversation. Pooja also has a question about the youth getting infected and spreading in proportion to the number of youth in terms of population, which also you've talked about. Shivam Arora, I think let's take this last question. If this is the case, why are exams not being cancelled or postponed? Is the government trying to avoid strain on the education system next year to build up a backlog? So I think the first part is what we should look at, that you have this data in front of you, and yet you want to do the NET exams, you want to do the JEE mains and not postpone them.
So that is a kind of a tricky thing. I'm not sure why this insistence, because the data doesn't actually support this, and this is their own data. This is not even like sources. This is official government data that is available on the IDSP website, the national data, the state's data we got. So I'm not sure why this insistence. Perhaps to sort of force normalcy, if that's one explanation, because medically I'm not sure this is the right thing to do.
In fact, if you want to understand more about why the government is pushing forward or pushing so much for these exams and what this entire tussle is about, you can watch Friday's episode of Government Matters with my colleague Kritika Sharma, who covers education and who brought you all these answers. So that might give you the other aspect of the question. Well, thank you so much, Abantika, for helping us understand the issue. Thank you for sending your questions and for watching Government Matters. Keep subscribing to our YouTube channel.